So we've known about monkeypox since the 1950s, and there have been outbreaks around the world since then. It's a virus infection that is common in rodents in Africa, and transmission can occur through to humans through, for example, coming into contact with infected animals or eating infected animals. Once a human becomes infected, it's close skin-to-skin contact that then causes that transmission between humans, and that's what we're seeing at the moment. Your viewers may have seen that it's being reported that there have been cases identified in the gay community. It's actually the skin-to-skin contact that we are concerned around, and transmission can come through coughs, sneezes. So this is not a condition that is just affecting the gay community. It can happen in the heterosexual community and children too.
Gibraltar's got a population of apes, of monkeys, as we know. Is that something to be concerned about?
Not for this virus, no. This virus comes from rodents in southern and western Africa, so not currently in Morocco, although we are keeping a very close eye on the spread of this infection. What we are asking people to do is, if they have recently travelled in the last 3 weeks to western or central Africa, or they've come into contact with somebody who has monkeypox, and then they develop a rash, headaches, fevers, chills, muscle pains, please call 111 for advice, because what we want to do is triage people before they come into hospital. We don't want people potentially spreading monkeypox around vulnerable patients in the hospital setting. So I'll just repeat that. If you have headache, fever, muscle pains, and a like a chicken pox type rash, but this is a very severe rash, and you know you've come into contact with somebody with monkeypox or have been to Central or Western Africa, please call 111 for advice.
Well, although a new disease sounds scary, especially after COVID, the symptoms are relatively mild, aren't they, especially in adults?
Yes, this is an unpleasant illness, but the majority of people, it's self-limiting and they will recover. As I say, this is a virus we've known about since the 1950s. This is not a new virus. The difference with COVID was that was a new virus. We had no experience of that. So these are outbreaks we've seen before, and most people, although it's unpleasant and the rash can look quite dramatic and frightening, it is something that people recover from.
Well, we now have things like lockdowns and vaccines in our psyche. What measures is public health taking?
So absolutely, we're in a period of enhanced surveillance at the moment. We are working with clinicians across the GHA to make sure that we can diagnose monkeypox if and when we get a case, and then we've got treatment options in place. So if we were to get a case, the public will be very used to what we do next. It is about contact tracing to try and identify where the person's been, who they've been in contact with, make sure they get appropriate treatment, and we're in discussion with the UK to look at, can we get some smallpox vaccine out here to offer potentially healthcare workers who may be coming into contact with cases some more protection.
Well, we talk vaccines, prevention, but what about treatment?
So we were in discussion with clinicians. We're looking at our antiviral stocks. Again, there's a lot of learning from COVID in terms of our antiviral pathways. So the clinicians are already in discussion around what antiviral stocks we've got and appropriate treatment should we need it. Now, most people, we will require them to self-isolate at home. They won't need to be admitted to hospital.